Chapter 8, Treatment of Psychotic Disorders. In this chapter, we will explore the various schizophrenia spectrum disorders, their prevalence, causes, and treatment. The role of both typical and atypical antipsychotics is explored, with advantages and disadvantages presented. Within the schizophrenia spectrum disorder, there are various symptoms. Clients with schizophrenia need to be treated in the early stage to help prevent relapse, morbidity, and mortality. Clients with schizophrenia have a higher morbidity and mortality associated with the early phases. Overall, the disorder is associated with an increase of mortality due to lifestyle and chronic illness associated with schizophrenia spectrum disorder. It is common for clients with schizophrenia to have other family members with the same disorder. It is also a theory that schizophrenia is more common in urban areas. This theory is called the social drift. The social drift is believed that due to a client's vulnerability to schizophrenia, that they have the tendency to lose their social and occupational status and drift towards poverty in urban areas. Schizophrenia is believed to be a brain disease with numerous abnormalities in the structure, function, and neurochemistry in the brain. Abnormalities in the brain structure would include enlarged lateral ventricles, a decrease of gray and white matter, the mediotemporal structure, hippocampus, and/or amygdala might be smaller in size, as well as a decrease in cerebral blood flow and metabolism in the frontal lobe. Neurochemical abnormalities. In research, it has been found that when too much dopamine was being released, it caused psychotic symptoms. This phenomenon is called hyperdopaminergic. Possibly also serotonin, norepinephrine, acetylcholine, and other neuromodulators that may influence actions in the brain to play a part in schizophrenia. Other theories look at a viral hypothesis of the retrovirus, which alters the genetic code and could be passed down through generations. Early childhood viral infections leading to scar tissues forming could also play a part. Pregnant women exposed to the flu during their second trimester has also been explored. Some researchers think that poor parenting could cause schizophrenia. It is theorized that the client's disturbance that has affected their capacity to relate to others, and this capacity is thought to reflect dysfunction in the mother-infant dyad. The stress diathesis, which is another theory, theorizes that various internal and external stressors can convert vulnerability for schizophrenia into symptoms. And finally, expressed emotion. Several family factors, including criticism, emotionally over-involved attitudes and behaviors, negative affective styles, may precipitate the illness and aggravate its course. Schizophrenic clients living with families with high EE have a higher rate of relapse than those living in families with low EE. The following are symptoms of schizophrenia. When we talk about positive symptoms, we look at symptoms that are additional to what and I use this loosely, a normal person would have. So look at additional symptoms when we use the word positive symptoms. A person with schizophrenia or any kind of psychotic disorder might display hallucinations, which can be with any of the five senses: the sight, taste, touch, smell, hear. They might hear voices, see things that aren't even there, feel things crawling on them. So that's what we look at when we talk about hallucinations. Delusions, in which we're looking at, has to do with false beliefs, and although we might show them to the contrary that they are incorrect, they really do believe these certain things that are occurring, or they might believe things about themselves. They might believe they have superhuman strength. They could believe people are following them. So that's when we look at our delusions. A break from reality has also to do with our positive symptoms. Negative symptoms deal with traits that they might have that are missing, a deficit. So they might have a poverty of speech, a disorganization of thought, a flat affect, flat facial expression, apathy, their inability to understand others' emotions, poor hygiene. So once again, when we look at negative symptoms, these are things that they are missing that a normal person might have. From a cognitive stance, it's a broad band of impairment in their cognition, from their ability to organize things, mentally organize things, a higher order of thinking, as well as attention, and neuropsychological functions too can also be affected. Following by mood, they might have depression, agitation, anxiety, and insomnia, irritability, and mood liability. So all of these things, a person with schizophrenia, they may have symptoms from every one of these areas. They may have more symptoms from one area than the other, so it just depends, and it could just go in a variety of ways depending on that person. Psychotic clients should be evaluated for confounding factors such as substance abuse, medical illness, and other psychiatric and developmental disorders so that we can rule these things out. Once the therapist has eliminated other causes for the psychosis, then they can create an appropriate treatment plan. Specific social skills training is more effective than generalized social skills training. Now, although since schizophrenia is considered to be a brain disorder, the main cornerstone of treatment will be medication. However, they can benefit from therapy. Now, when we're looking at a social skills training, we're looking at more so as opposed to just a generalized, hey, let's teach you how to interact with people. Let's teach you how to get a job, or just how to, it should be more specific to the deficits that client is exhibiting. So if the client has a problem, let's say with eye contact, or initiating a conversation, or responding when someone asking them a question, then that will be what the client and the therapist will work on. It will be specified to what that client needs, as opposed to a general training that is believed to work in a quote unquote with all schizophrenics. Family therapy is very important also. Family therapy generally improves symptoms, it decreases relapse, and improves social and occupational functioning. In individual sessions, it is important to educate the client about medication and to improve the compliance in them taking their medication. It is believed through research overwhelmingly that a combination of family therapy and social skills training administered simultaneously will work best when treating a client with schizophrenia. Atypical antipsychotics. When we are looking at medication treatment, we will look at two different types of medications. Typical psychotics, which are the older, and atypical antipsychotics, which are the newer antipsychotic medications that are recommended. Atypical antipsychotics have less or no extrapyramidal symptoms, or what we would call EPS. Starting with the atypical antipsychotics, risperidone, or the brand name Risperdal, is the treatment of choice for the first episode of a psychotic client with positive symptoms, negative symptoms, or a combination of both. Other atypical antipsychotics, such as Abilify, Zyprexa, Geodon, and other ones, are secondary to risperidone. So when we're looking at this, we also want to look at what symptoms are these medications, these antipsychotics treating. The efficacy for positive symptoms, improved cognition, and improved mood have been. Although atypical antipsychotics have shown similar efficacy, the side effect profiles have been found to be quite different. They can range from weight gain to irregular periods, enlarged breasts, production of breast milk in males, as well as other side effects. So as a practitioner, it is very important when the client is going back to discuss how the medication is working, is to also discuss the side effects that they are experiencing. This will play a part in weighing out if the overall treatment is worth the side effects that they are experiencing. Typical neuroleptics or typical antipsychotic medication have similar efficacy with respect to the positive symptoms in schizophrenia, but they may actually worsen the negative symptoms because of their side effect profile. The extrapyramidal symptoms that they present have a tremendous negative impact on treatment. EPS is commonly treated with anti-Parkinson or anticholinergic medication, but this may interfere with cognition. Typical antipsychotics also have various side effects and adverse drug reactions when prescribed with other over-the-counter medication as well as prescription medication. Typical antipsychotics are known to cause, and as mentioned in the previous slide, EPS. EPS, extrapyramidal symptoms, consist of acute dystonia. Acute dystonia would look like if a client it is very uncomfortable and frightening. The client may be very rigid and stiff. It might also have a look of a cogwheel rigidity. When we look at the Parkinsonian side effects, it contributes to the negative symptoms of the illness. It reduces facial expression, affective responses, and gestures, as well as motor intonation. Now, the client is already struggling with negative symptoms, so if they are having these Parkinsonian symptoms, it is making it worse. Akathisia is a common subacute side effect which is related to the medications, which consists of restlessness, anxiety, agitation, or insomnia. And finally, the tardive dyskinesia is a major chronic extrapyramidal symptom that should be avoided if all at possible. And that is because with this, the client may do things like lip smacking or lip puckering. They may blink their eyes uncontrollably. With these EPS, once again, it is treated with anti-Parkinson or anticholinergic medications, but we also know that this may interfere with their cognition. Antipsychotic contributes to discontinuing therapy and long-term compliance issues with the client, which is why most physicians will lean towards the newer, cleaner, atypical antipsychotics. Adequate dose of antipsychotic medication is very important. And these are other issues that need to be considered. Each drug has a different dose because of the different potencies, but they all are equally effective in a therapeutic dose. For chronic patients, the dose may be higher than for those who have had a first episode. Therapeutic drug monitoring is also very important, and researchers have considered the plasma levels most clinically useful. So as kind of like with lithium, when taking antipsychotics, a client might go in every 3 or 6 months for laboratory testing. When we are addressing adequate treatment trials, what is very important about this is it is recommended by experts waiting a minimum of 3 weeks and a maximum of 6 weeks before making any major changes in the treatment regimen. Some prescribers wait longer than 6 weeks if the patient is showing a partial response, especially during the second and subsequent trials. When switching from one atypical agent to another, most prescribers recommend cross-titration as opposed to an overlap and taper. So cross-titration refers to tapering the dose of the first agent or the first medication while gradually increasing the dose of the second antipsychotic. As with antidepressants, the antipsychotic medication may be augmented if the client has shown a partial response. In some cases, a combination of an atypical antipsychotic and mood stabilizer has been shown to be clinically useful. Certain medications such as Symbiex is an example of a combination consisting of Prozac and Zyprexa at various doses. This may be useful in clients with schizophrenia and depression or the depressive phase of a bipolar disorder. In some clients, we may see a treatment refractory, and this is looked at as a client failing to respond to one or more conventional antipsychotic and two atypical antipsychotics. A medication such as, with the brand name Clozaril, is indicated for treatment of individuals with refractory schizophrenia. And once again, we must mention ECT may be considered after other options have been exhausted. But the primary goal of treatment are rapid and complete control of acute psychotic symptoms, avoidance of functional deterioration, and prevention of relapse.